Hello, let's start the first video in our YouTube channel by a frequently asked question about how to formulate a differential diagnosis from the panoramic radiograph. Will be a systematic workflow for clinician and dental students. So, what is the panoramic paradigm? The clinical advantages is that panoramic radiographs provide a comprehensive single image projection of the entire maxillomandibular complex, and they are essential for detecting broad osseous pathologies, fractures, and developmental anomalies that intraoral imaging would completely miss. However, the limitation is subject to structure distortion magnification, superimposition, and ghost shadows. Because panoramic radiographs are 2D representation of the complex 3D anatomy, a strict structured protocol is mandatory to build an accurate differential list. So, the first step is a technical validation. Ensure the radiograph is diagnostic. First, before starting doing your differential diagnosis list, you have to follow these. The outer border trace from the right condyle down to the mandibular border across to the midline up to the left condyle, and then the midface complex analyze the left maxillary sinus and nasal cavity, heart, palate, and right sinus. Then the periapical zone trace the periapical regions of the lower teeth, then loop to the upper teeth, and finally the dentition. Evaluate individual crowns, roots, pulp chambers, and bone levels. And then characterization of the lesion. First, you have to identify the location and the distribution of that lesion. Define the borders, if the lesion is unilateral or bilateral. Is it associated with a tooth follicle located below the alveolar canal or sitting within the maxillary sinus? Borders and margin. Examine the transition zone. Well-defined corticated borders point to slow benign growth. However, ill-defined ragged margins point to aggressive, malignant, or inflammatory process. Internal structure. Identify the density profile. Is it completely radiolucent, mixed, or highly radiopaque? And watch for unilocular versus multilocular soap bubble appearances. The surrounding effect of this lesion. Assess the clinical impact. Look for the divergence or root resorption, cortical expansion, teeth displacement, or sensory nerve canal displacement. These are milestones while you're thinking. Inflammatory or cystic lesions, common lesions like radicular cysts or apical granulomas, frequently linked to pulpal necrosis or periodontal diseases. However, odontogenic tumors, lesions arising from tooth-forming tissues like ameloblastoma or odontogenic keratocyst, often multilocular and located in the posterior mandible. Finally, the fibro-osseous lesion are disorders were born and replaced by fibrous tissues, like the cemento-osseous dysplasia, which is characterized by mixed density transitions. You should formulate a list of 3 to 5 target diagnoses, and this is the art of prioritization. Aggressive versus benign behavior. Benign lesions typically expand slowly, push cortices outward without perforating, and gently display the teeth without causing rapid root resorption. However, aggressive lesions often show aggressive root resorption, destroy cortical boundaries, and can display the inferior alveolar nerve canal. Clinical presentation. A radiograph is simply a shadow. Never diagnose a patient in vacuum. Correlate your radiographic finding with direct sign, chief complaint, history of pain, pulpal vitality testing, presence of swelling, tooth mobility, and soft tissue changes. The patient demographics also are very important, such as age and sex, are a major filter in the clinical decision-making workflows. For example, a periapical radiolucency in the vital lower anterior teeth in a middle-aged female highly suggests an early stage cemento-osseous dysplasia requiring zero active treatment. So, the advanced diagnostic pathway, the 3D imaging like 55%. However, the histopathology biopsy 30% and routine monitoring makes the rest 15%. Your turn to diagnose. Adopt the system to consistently evaluate your radiographic diagnostic accuracy. And don't forget to follow our page and our YouTube channel for more interesting cases. Thank you and see you soon.